Are you experiencing unexplained tiredness, fatigue, poor memory, difficulty thinking, numbness, or loss of muscle mass? It could be a vitamin B12 deficiency, and even if you use multivitamins with vitamin B12, it might not solve the problem. What should you do? Hello family, welcome to another video here on our channel. Did you know that even if your test comes back normal for vitamin B12, it could still be low? It can cause serious symptoms that may become irreversible. In this video, I'm going to talk about who tends to have low levels of vitamin B12, the right tests to detect this deficiency, and how to quickly restore your levels. Of course, this video deserves a like. Don't forget to give me a thumbs up, guys. I know it doesn't cost you anything. Share it in your groups. Show that you're well informed and you're not subscribed to the channel. Subscribe, it doesn't cost anything. And don't forget to also hit the bell. And of course, feel free to comment. What about you? Have you had symptoms like tiredness, fatigue, memory lapses, or slow thinking? Did you check your vitamin B12 accurately? Share your thoughts in the comments. Are you familiar with my website? No? On my website, you can find all my other social media with shorter information about health, quality of life, longevity, and fitness. My website has the supplements I use and recommend, plus my courses. Check it out at D as in data, R as in Romeo, Moacir, altogether.com.br. I'll split this video as follows. What are the main symptoms and how serious can vitamin B12 deficiency be, even leading to irreversible conditions? Who is more likely to have a vitamin B12 deficiency, to see if you fit into this group? What tests are used to detect this vitamin B12 deficiency? And no, it's not just by measuring the vitamin B12 level in your blood. And how to quickly reverse this vitamin B12 deficiency? Let's go. What problems does it cause? What are the main symptoms? Mainly neurological symptoms. Those are the first ones to show up, okay? So the person is experiencing memory lapses, sudden memory lapses, difficulty reasoning, and slow understanding of things. Many times even movement becomes slower. The person gets slow, sluggish all of a sudden, out of nowhere. This can indeed be a vitamin B12 deficiency. It can also be a deficiency of coenzyme or other B-complex vitamins. But it's more noticeable when B12 levels are low. And the problem with these symptoms is that if the proper physiological levels of B12 are not corrected, this person may develop dementia. Look how serious this is. And when this deficiency keeps spreading and a lot of time passes, it can damage the nerves and then cause a tingling sensation. Another very common symptom is anemia. Why? Because cobalamin is present in our red blood cells, and our red blood cells need cobalamin to form. And then the most common anemia is megaloblastic anemia, where the erythrocyte becomes enlarged and non-functional. It doesn't work properly, so the person also feels without energy, feels unmotivated. That tiredness, that fatigue is due to this anemia. This muscle weakness invariably leads to sarcopenia, which is the progressive loss of muscle mass. In fact, those who exercise like bodybuilders use B12 for muscle growth. It's a very important vitamin in this process. And on top of that, B12 deficiency also increases homocysteine, which is a much more serious cardiovascular risk factor than cholesterol. So it increases your chance of having a heart attack or a stroke. Look at the problems that can be caused by a deficiency of this vitamin. Well, Moacir, why does it happen? Which groups are most susceptible to B12 deficiency? First, mainly elderly people who are over 60 years old. These people need to take methylcobalamin supplements, vitamin B12. Why, Moacir? Because as we age, we tend to produce less stomach acid, our pH ends up rising, acid production drops, and with that there's a decrease in the production of intrinsic factor in our stomach. It's the intrinsic factor that promotes the absorption of vitamin B12 that we get from our food. So many times a person has a good diet, a diet rich in vitamin B12, but the decrease in this intrinsic factor reduces absorption. So that's why supplementation is necessary. Elderly people over 60 years old also need to supplement coenzyme Q10, okay? There's also a decrease in the production of coenzyme Q10 from that age on, so coenzyme Q10 is also responsible for improving our cognition, our memory, our muscle capacity, and our energy. So both coenzyme Q10 and vitamin B12 are closely linked to this brain issue and the matter of strength and energy. Then people who suffer from hypochlorhydria, which is the deficient production of hydrochloric acid in the stomach, often the person is young, but they have this deficiency, and many times this leads to gastritis or reflux. Most people think that gastritis and reflux are caused by excess acid, but often it's due to a deficiency. With low acid production, there's less intrinsic factor and reduced vitamin B12 absorption. If you use proton pump inhibitors, antacids, if you suffer from gastritis and are taking antacids, omeprazole, pantoprazole, rabeprazole, cimetidine, ranitidine. These substances change the pH of your stomach and decrease the absorption of vitamin B12. So people who use antacids chronically also have low levels of vitamin B12. Vegans and vegetarians. Vitamin B12, as we are going to talk about here, is very present in foods of animal origin. Vegans and vegetarians don't consume it, so they invariably have a B12 deficiency. And also those who overdo it with alcohol, right? Those who overdo it with alcohol, chronic drinkers, also have a B12 deficiency. And I was about to forget, people who have had bariatric surgery, okay? People who have had interventions in the stomach and intestine, bariatric surgery, also have a smaller absorption area and low levels of B12. So all these groups I just mentioned to you need to take B12 supplements. Moacir, so how do I know if my B12 is low? I did a blood test and it said it's okay, that it's great. Unfortunately, my friends, the amount of vitamin B12 in the blood doesn't reflect the intracellular amount of this B12. And also many times people read the test results wrong. The levels of B12 considered healthy are above 600 picograms per milliliter, above 600. But, as I said, it's a very non-specific test, so you have to confirm it with two other tests that I'll mention here for you, the homocysteine test. So you measure your homocysteine. If it's elevated, above 10, you probably have low B12, okay? Because B12 is a cofactor for converting methionine into cysteine, and it goes through homocysteine. So did your homocysteine go up? You can be sure that your B12 is low, and also B6 and folate. But the most specific test to detect the correct levels of B12 is the measurement of methylmalonic acid. Methylmalonic acid is much more sensitive than directly measuring B12. As I mentioned, B12 is often at low intracellular levels and normal blood levels. So your test may show normal B12 levels. You're having all these symptoms, then you measure methylmalonic acid, and it's elevated. If it's elevated, it's because your B12 is low. So you need to do this series of tests. Talk to your doctor to get the proper evaluation. Moacir, okay, it's low, my methylmalonic acid is high, my homocysteine is high, my B12 level is low, so what am I going to do? Well, vitamin B12 is relatively abundant in certain foods like meats, organ meats, liver, beef liver, chicken liver has a lot of vitamin B12, eggs have B12, and dairy products have B12. Moacir, but I'm a vegetarian, I'm vegan, I don't eat those foods. Well, there's a little bit of B12 in some yeasts, in shiitake mushrooms, but if you're a vegetarian or vegan, I recommend that you take supplements, okay? Take B12 supplements. It's very common among vegans and vegetarians to have anxiety problems, difficulty thinking, and sometimes even depressive episodes exactly because of a B12 deficiency. So pay attention if you're vegetarian or vegan. But Moacir, I'm over 60, have hypochlorhydria, am being treated for gastritis, or am vegan or vegetarian. What should I do? You said that even when eating the foods, the intrinsic factor there is produced in very small amounts and absorbs very little. In this case, I also recommend that you take supplements, okay? There is B12 supplementation through intramuscular and intravenous routes, but you can also take it orally through capsules. It can be sublingual or oral, okay? But pay close attention. Taking B12 supplementation in the form of methylcobalamin, which is the most active form and is a methyl donor, will even help control your homocysteine levels, which is that cardiac factor, a complicated cardiac risk factor. So, always supplement in the form of methylcobalamin. That's very important. If you choose to take it orally through capsules, multivitamins have a very low dosage of methylcobalamin, and it's not enough for those who are deficient in vitamin B12. At least, okay? 1,000 micrograms, start with 1,000 micrograms. Some people take 1,000, some take 2,000, 3,000, even up to 5,000 micrograms. Of course, it depends on the concentration, it depends on your test results, but for maintenance, at least 1,000 micrograms of methylcobalamin. Okay, guys, on my website, go to my website. My website has all the supplements I use that I recommend, okay? The B12 that I use is there. I already have to use B12, okay, guys? My B12, to keep it just the way I need it, I have to supplement. I take 1,000 micrograms of B12 every day, okay? All the supplements I use, magnesium, omega-3, vitamin D, are listed on my website. My courses are there, my other social media are there, go check it out. It's www.D as in David, R as in Richard, Moacir, altogether.com.br. And if you're not subscribed to the channel, guys, it doesn't cost anything, it's free. Just click on subscribe. Don't forget to hit the bell, don't forget to select all. I hope you enjoyed this video, I hope it was useful for you. Comment down below. Have you been checking? Have you been measuring your B12 levels? Have you been measuring them correctly? Comment down below. Don't forget to like. If you missed it earlier, give me a like now. A big hug, my friends, and see you in our next conversation. See you then.